Good morning. Let's learn about the immunomodulators. The first is steroids. Steroids, what they do is they're going to block the production of inflammatory mediators by local immune cells, and they are going to induce apoptosis of activated lymphocytes. And let's learn about the other drugs. First is cyclosporin and tacrolimus. They're going to block calcineurin. So cyclosporin and tacrolimus, they are calcineurin inhibitors. Basiliximab and daclizumab, they're going to block interleukin-2 receptor, which means they're going to block CD25 receptors. So cyclosporin and tacrolimus, they are calcineurin inhibitors. Basiliximab and daclizumab, they are interleukin receptor 2 blockers, CD25 blockers. Everolimus and sirolimus, they are mTOR protein inhibitors. Azathioprine and methotrexate, they're going to block the S phase in the cell cycle. Neuromanab is going to block CD3. Alemtuzumab is going to block CD52. First, let's learn about the calcineurin inhibitors, so which is cyclosporin and the tacrolimus calcineurin inhibitors. So first is what these calcineurin inhibitors do. They're going to decrease the interleukin-2 synthesis. Where are they used? They are used in graft versus host disease and in the graft rejection. But the first line for graft versus host disease and in the graft rejection, the first line drug which is used is cyclosporin. If there is no response to cyclosporin, the second line drug is tacrolimus. So cyclosporin is less effective, at the same time it is less toxic, whereas the tacrolimus is a rescue drug. It is more effective, but it is more toxic. And calcineurin inhibitors are also used in skin disorders like lichen planus and atopic dermatitis. And calcineurin inhibitors are also used in steroid-resistant ulcerative colitis and nephrotic syndrome, in myasthenia gravis, rheumatoid arthritis, and in Behçet's disease. But the drug of choice in case of steroid-resistant ulcerative colitis, nephrotic syndrome, myasthenia gravis, rheumatoid arthritis, and Behçet, the drug of choice is cyclosporin. But calcineurin inhibitors like tacrolimus can also be used, but the drug of choice remains cyclosporin. Let's learn about the side effects. So, as I already mentioned, tacrolimus is more effective and at the same time it is more toxic. So, with both the drugs, which means cyclosporin and tacrolimus, they both are neurotoxic, they are both are nephrotoxic and hepatotoxic, hyperkalemia and hyperglycemia. These are the side effects of both cyclosporin and tacrolimus. But cyclosporin alone causes hirsutism, gum hyperplasia, hyperlipidemia, and hyperuricemia. Let's learn about mTOR inhibitors, sirolimus and everolimus. So what these mTOR inhibitors they do, they're going to block the G1S phase of the cell cycle proliferation. Sirolimus, which is otherwise known as a rapamycin, is actually used in GVHD and graft rejection. I already mentioned in GVHD and graft rejection, we use cyclosporin or tacrolimus. As an add-on drug with cyclosporin or tacrolimus, you can use a sirolimus, rapamycin, which is mTOR inhibitors. And nowadays, for cardiac stents, drug-eluting stents are used. In that cases, in those drug-eluting stents, you can use mTOR inhibitors like sirolimus. And it is also used in cases of uveitis. And temsirolimus is actually used in cases of renal cell carcinoma. Everolimus is used in RCC, renal cell carcinoma, renal angiomyolipoma, pancreatic carcinoma, ER-positive breast cancers, and astrocytoma. The side effects of mTOR inhibitors is they're going to cause lymphosine, hemolytic uremic syndrome, myelosuppression, thrombocytopenia, and oral ulcers, raised lipids, hypertriglyceridemia. The next is let's learn about daclizumab. I already mentioned daclizumab is an interleukin-2 receptor, which is CD25. So CD25 inhibitors is daclizumab, which is used in multiple sclerosis. Basiliximab is also interleukin-2 receptor CD25 inhibitor, which is used in the prophylaxis of acute graft rejection. Murobanab is a CD3 inhibitor, which is used in the treatment of acute graft rejection. But the side effect of muromanab is it's going to cause a cytokine release syndrome, so the patient is going to present with fever and chills. Alemtuzumab is a CD52 inhibitor, which is used in graft rejection and multiple sclerosis. Abatacept is going to block CD8086. It's going to inhibit T cell activation, and that's why it is used in cases of rheumatoid arthritis. Belatacept is going to block CD8086 and blocks the T cell activation. It is used in the prophylaxis of drug-resistant graft rejection. Alifacept is going to block CD2 and inhibits T cell activation used in the prophylaxis of drug-resistant graft rejection. Azathioprine is a prodrug of 6-mercaptopurine. They're going to block the S phase of the cell cycle, which is used in graft rejection prophylaxis, rheumatoid arthritis, multiple sclerosis, ulcerative colitis. Both 6-mercaptopurine and azathioprine are metabolized by the enzyme thiopurine S-methyl transferase or TPMT. and that's why they cause increased risk of toxicity if the patient is deficient in this enzyme because they are metabolized by TPNT, which is thiopurine methyltransferase. The side effects of azathioprine and 6-mercaptopurine is bone marrow suppression and hepatotoxicity. The next is mycophenolate mofetil. Mycophenolate mofetil is contraindicated with azathioprine. Let's learn about the mechanism of action of mycophenolate mofetil. It's going to inhibit IMP dehydrogenase. That's why they're going to block the de novo synthesis of purines, which is the only pathway for purine synthesis in lymphocytes. So selective toxicity for lymphocytes. And where is mycophenolate mofetil is used? It is used in cardiac transplant and in bone marrow transplant patients as a first-line drug. For other transplants, mycophenolate mofetil is a second-line drug. It is also used in rheumatoid arthritis, myasthenia gravis, and inflammatory bowel disease. The side effect is they're going to cause GI upset and bone marrow suppression. Anakinra is interleukin 1 receptor inhibitor. Interleukin 1 inhibitor is anakinra, which is used in rheumatoid arthritis. Anakinra is a drug of choice in cryopyrin-associated periodic syndrome. It's used in the treatment of juvenile idiopathic arthritis, which is Still's disease. Canakinumab is also interleukin-1 inhibitor, which is used in CAPS, which is cryopyrin-associated periodic syndrome, and Still's disease. Also, canakinumab is used. Rilonacept is interleukin-1 inhibitor, which is used in acute gout. Let's learn about an important drug, which is thalidomide. Actually, it was previously used for motion sickness, but banned because of ocomelia, but is now reintroduced because of its anti-inflammatory effect, immunomodulatory, anti-neoplastic, and anti-angiogenic effect. It was actually introduced as sedative hypnotic. Let's learn about the uses of thalidomide. It's used in CML, chronic myeloid leukemia, pancreatic cancers, rheumatoid arthritis, Behçet's disease. Behçet's disease is nothing but oro-ocular genital syndrome, GVHD, graft versus host disease and graft rejection, AIDS-related after ulcer, multiple myeloma, malignant melanoma, erythema nodosum leprosum, and in cases of sarcoid. The side effects of thalidomide is sedation, peripheral neuropathy, phocomelia, ocular side effects, rash, thrombosis, and constipation. Thank you.